Here I was already talking with the mute on. I should know by now. I'm Avril Benoit, and welcome. Thanks for joining us for this series that we're doing called Let's Talk COVID-19. We've been doing this every couple of weeks, and it's really important for us to stay connected with you over the course of the pandemic when so many of us are separated. I also just want to acknowledge that today we're going to be talking about one of the places where we're working on the pandemic, COVID-19, Yemen. At the same time, our thoughts are very much with our colleagues in Beirut and all the people of Beirut. We are doing this live on Thursday. You may be watching it, the recorded version, some days later, so certainly things are changing. But since we heard of the massive explosion, our hearts really went out to everyone there, and I just want to acknowledge how hard it must be for everyone who is a first responder trying to help. For the teams of Doctors Without Borders, of Médecins Sans Frontières, we have numerous teams in different parts of the country, including in Beirut, and they've been working very hard to try to support the local capacity there to provide medical support. So we'll hear just a bit about that in a moment. I'm Avril Benoit. I'm the Executive Director of Doctors Without Borders in the United States. We are also known by our international name, Médecins Sans Frontières. MSF is the acronym you'll often hear over the course of this discussion. And I just want to really focus today on Yemen because it's a place that is one of those crises that has a compounding effect, much like what's going on in Lebanon right now with the economic collapse and with the pandemic, all the burden on the political life of the country. In Yemen in particular, we have a national health system that's already been pushed past the brink of collapse for years because of a devastating conflict, of course. And as COVID-19 has come into it, you know, we've had a spike in deaths in Yemen. Our teams in Yemen are dealing with many challenges there, from having access to COVID tests, personal protective equipment, which has been a pressure point for many of our teams around the world. And of course, inadequate hospital staffing, misinformation about the virus, all the things that could go wrong seem to be going wrong. But we are working with health colleagues from Yemen to make it so much better. So we're just going to really focus on that today. Before I continue, a couple of quick little notes about this webinar. We will go for around 45 minutes. Wherever you're joining from today, you can join with your questions. You can ask them. If you're watching on Zoom, send the questions through the Q&A. It's just there at the bottom of your screen. If you're joining us on YouTube Live or Twitch, you can send the questions into the comments section. We will prioritize, of course, questions related to the pandemic in Yemen. So joining me today, we have three guests, Dr. Nizar Mohammed. He's an MSF anesthesiologist and an intensive care unit doctor in Yemen. We also have Dr. Diana Galindo Pineda. She's the medical team leader for MSF in Yemen, and Hassan Abouchar, Deputy Emergency Desk Manager for MSF. And I'd like to say hello to all of you. Are you all there? No. We'll just make sure that that we have established contact. Hassan, maybe you could tell us, you're also keeping an eye on what's going on in Beirut. Maybe you can just give us a quick overview of the kinds of things that we're trying to do to support the injured in Beirut today.
So first, say that our teams in Beirut are doing fine. Directly after the blast or the explosion, a couple of hours after, we have been able to take what we have in stock in terms of essential drugs that could be useful in the hospitals that were overwhelmed with wounded. So we distributed some of our stock, and since then we have been going around in the different neighborhoods of Beirut, doing assessment and looking at support we can do in terms of medical care for the people in the hospital and outside, but also other needs for the people who are displaced and left without homes and are staying in different areas from where they are originally. So we are sending drugs inside of the country, and there's also extra team that will join the teams in Beirut soon.
Okay, it's really good to hear. It must be so difficult for them, and we were heartened soon after the blast to hear that the MSF staff was all accounted for, because that's one of the first things that you have to do is just say, where are your people and is everyone okay? And that's certainly something that we know what a close call it was for so many of them. Maybe I could just check in with you, Diana. Tell me where you are and what's on your mind today.
So I am in Sana'a. I'm actually next to Dr. Nizar. We're in the coordination office. It's raining a lot, so I hope that connection doesn't cover anything. That's it. Okay,
and how about you, Nizar? How are you today?
Fine, I'm fine. But as Dr. Diana said, it's raining too much. It was so difficult to come to the coordination office. I'm now in the head of patient office.
Okay, and so what sort of impact does the rain then have on movements around the city?
It's so difficult. A lot of streets, a lot of them is broken, and you cannot cross for several hours sometimes.
Well, let's talk.
So it's not only sorry, it's an issue for our staff to move, but also for patients to move around, and
yes.
Pharmacy and everything is really difficult to move things around the city.
Mm-hmm.
We are likely to have a little bit of a delay on the call, but that's okay. We'll just get used to it. Hassan, maybe you can just start by giving us a general overview of how COVID-19 has affected Yemen.
Well, COVID-19 arrived, and first of all, we were very surprised that COVID-19 arrived to Yemen. Yemen has been, since the beginning of the war in 2015, cut out somehow from the rest of the world. Half of the country has some sort of an embargo on it, where airports are closed, no commercial flights, ports are very heavily controlled. And then in the south of the country, there's not much going on, not much exchange, one plane per day maximum. So we were very surprised that the virus arrived in this state. After 5 years today of war, the situation, the economic situation on the population is very difficult to do it day by day, to be able to feed their families, to give to the babies good food, good milk, what is really essential for their nutrition. On the same time, the health system in the country is already, we can say, collapse, is surviving on cost recovery. Patients have to pay for emergency services, and the rest on NGOs and hospitals like our hospitals that we run that are free of care for the population. The COVID, when it started, it was a big shock for everyone. The Yemenis didn't believe it, and I understand that. They didn't believe that it exists, so it went unnoticed. The Ministry of Health didn't have testing capacity. So we were surprised directly by patients arriving on their last breath to our hospitals. So nobody was ready for it. At the beginning, the first weeks were very, very difficult. We had very high mortality. We knew first about the epidemic by counting tombs in the graveyard. We saw a big increase of deaths, especially first in the city of Aden, then in the city of Sana'a. And surely the hospitals the hospital of the Ministry of Health couldn't cope with that. And it's really a sad situation even before the COVID outbreak, and this outbreak just made it much worse.
I can imagine. Diana and Nizar, you're both working at the Al Kuwait Hospital in Sana'a. Can you describe, Diana, what it's like there at that hospital?
So we have, we're working with the Ministry of Health. We have an ER that gets all the patients, we triage them. Some of them we discharge them home with just some advices about how to self-isolate. And others that come in a bad shape, then we keep them rather in the IPD or the ICU. We have both services.
And Nizar, is the ICU very busy where you're working?
Actually, there is a big difference in between since 2 to 3 months from the beginning of the pandemic and the crisis. And on those days, the numbers decreased a little bit, but also the risk factors decreased more than 50%. There was a huge number of mortality case in the ICU, as it was in all over the world. But now it's decreased a lot in comparison with before.
It's difficult though when you don't have access to testing. We have already a question that's come in from someone watching on Zoom and asking, is there a real sense of the infection rate of COVID-19 in Yemen? Hassan, you mentioned in the beginning, the best we could do was count newly dug graves. How are things now in terms of knowing who has it?
Just to give an example of what we have as numbers today, official numbers of COVID-19 cases officially declared by the government of Yemen is around, I don't have the exact number, but it's around 1,700. In our 2 hospitals, we have so far treated around 1,200. And those are severe cases or very, very severe cases. We know that we don't cover the whole country. We only cover 2 cities. We usually see from the numbers that only 5% require intensive care unit. So where are the other 95%? They are today not officially declared. So we think we are only scratching the tip of the iceberg from what we see today.
It must be so difficult to go out and run testing sites. Diana, can you speak to that challenge?
It's difficult because, as I was saying, even transportation can be a challenge, and there's shortages everywhere for tests. So Yemen is, of course, not an exception, and it's even more difficult to get them properly done here. So we go a lot with clinics, we go a lot with some other tests, X-ray, CT scan that we can do in some cases, but we trust a lot in the clinical sense of our physicians.
And Diana, how much did this arrival of COVID-19 affect the other medical work that MSF was doing before the pandemic?
So as you were saying, it's already as difficult situation, sanitary speaking, and the fact that everything stops for all chronic diseases makes it even harder. So we are now seeing a lot of patients that have comorbidities that do not go to, I don't know, their internist anymore, that cannot have any proper control of the cancer or hypertension or diabetes. And this is young and also old people. So the base, let's say, it's already affected, and then COVID is just coming and making it everything much more hard.
One of the things that has been very difficult for many teams and many medical staff all over the world really has been some of the misinformation. Even in the United States, I can tell you it's been absolutely appalling, the level of misinformation that's been going around even from people who should know a lot better. Maybe Nizar, you can tell us what it's like there, what sort of lies and falsehoods are spreading about COVID-19.
You know, because this crisis, it was suddenly and all over the world, not just only in Yemen. And regarding the Yemeni people and the community, they cannot believe that we have a COVID-19 in Yemen. They denied it from our society, even from our communities. They said we don't have a COVID-19. And there was a lot of people dying at home, and they don't know that they are getting the disease. Actually, we're receiving a lot of bodies because we have only one centers for washing the cadavers, and they shifting them to a specific place as guiding by Ministry of Health. So it was so difficult to get any numbers or any information from those people. Till now, we are still suffering from this issue.
Well, there are a number of issues that I'm sure our audience is interested in asking you about. If you're watching on Zoom, again, you can send your questions into the Q&A, and they will be passed along to me. If you're watching on YouTube Live or Twitch, just send the questions into the comments or the chat section, and we'll find them there. Let's talk a little bit about supplies. Hassan, you mentioned, the blockade, the difficulties of moving supplies in. Is there not a humanitarian sort of exception for medical people to be able to get what they need for this?
We do. We have been able to negotiate access in Yemen for humanitarian aid since after the war started in 2015. The system is very difficult. It's very cumbersome. It cost us a lot of money to be able to navigate it. However, we are able to get it in. But the problem is that usually in countries where we work in as Médecins Sans Frontières, where there is a situation of war or there's something, we operate as medical staff. We work in hospitals, and there are other hospitals nearby working. It's difficult to take a charge of a whole population of 27 million as of Yemen. The problem is that other hospitals and pharmacies are not able to bring in medical supplies quickly and as easily as we can, and it backfires on us because we are getting more. For example, what happened in Aden at the beginning of the epidemic is that the rest of the hospitals stopped working because they didn't have enough protective equipment. So we were the only hospital working in the city. And it's a trauma hospital. It's a traumatology hospital. We were receiving all the cases. So issues of supplies already were difficult around the world because the shortages of supplies related to this pandemic were very difficult to get in. We prioritized Yemen as an operation because we know that the country will not be able to get in other supplies rather else than the humanitarian aid.
You are watching a special webcast from Médecins Sans Frontières, or MSF, Doctors Without Borders. And my guests today are Dr. Nizar Mohammed, an anesthesiologist and ICU doctor working in Yemen, Dr. Diana Galindo Pineda, who is a medical team leader, and we also have Hassan Abouchar, who's a deputy emergency desk manager for MSF. And we welcome your questions. I actually have a question. It's clear that you are the ones who are working in Yemen itself. You're working tirelessly around the clock, even at the best of times, before this pandemic. Well, there are no best of times because of the conflict. Diana, how has the fighting, which is sporadic, affected the work that MSF does in this pandemic?
So in Sana'a, we have maybe a little bit less affection, let's say. In the south is definitely different. It depends on how far you are from the front lines. It doesn't stop. The war doesn't stop and doesn't respect the pandemic. So we just have to cope with having both populations still in need of care.
What effect is the staffing shortage having on our ability to deal with it?
Sorry, can you repeat the question, please?
What effect has the lack of medical staff and the collapse of the health system also, what effect has that had on our ability to support efforts to address the pandemic in Yemen?
That the quality of care will not be ideal, and we will not be able to reach the same care that we would like to provide. We don't have the ratio necessary to treat for a certain number of patients. We need a certain number of doctors and nurses. So it's really, really hard to reach a good level of care, and we're still struggling with it.
Yeah, and Hassan, we are trying to work also in support of other organizations. You have mentioned already the Ministry of Health. What sort of partnerships do we have in Yemen?
Well, most of the work we do in Yemen, we try to do it with the local authorities, which is the Ministry of Health, that operates hospitals, referral hospitals or other that need support. So we come and support to those centers, usually maternities or trauma centers, or even just general hospitals dealing with everything. So most of the time we work with the Ministry of Health, but we do it very closely with the centers themselves, especially smaller health clinics near the front lines that receive a lot of wounded population, but also with the population around that is suffering a lot. So we have direct contact with those health centers, and we support them directly with sometimes staff, sometimes drugs, depending on each of them. We do it a lot with health professionals. Local health professionals are the ones we do it with, and sometimes we do it alone, depending on the setup and what is the easiest way to do it.
Dr. Nizar, I have a question for you about the intensive care units. There has been, over the course of this pandemic, of course, a lot of new learning about intubation, oxygen, all the ways that you can support somebody in the ICU, what works less well than we thought it would. What has been your experience in the ICU?
At the beginning, actually, we have a lot of challenges regarding this subjects. When we are talking about oxygen supply, at the beginning, we don't have a reservoir in the hospital, and we're starting to receive the patient with using a manifold cylinder supplied by MSF. And we have big challenge also regarding the negative pressure vacuum system, which is mandatory in the isolation ICU room in COVID-19 ICU. And that's all. At the beginning, we have big challenge regarding the health staff, doctor, that they don't have any experience regarding those patients. So I was with them from the beginning. We are suffering a lot at the beginning, and I got an infection because of this difficulties of managing these patients.
You got the infection yourself?
Yes.
And how was it for you?
It was so difficult for me because, you know, I was afraid. I transferred the infection for my wife, and she's crying a lot, and she thought that she became a widow within days. Really, it was so difficult for me and for my family also. But thanks God, I come back and I resume my activity again inside the ICU, and I'm still working till today.
Yeah, it must have been so difficult. How has the infection rate been among medical staff, healthcare workers, and even hospital staff?
Yeah, there was, because, you know, there was a big shortage in our PPE, personal protecting equipment at the beginning, and most of them, they don't have experience how to use it. We did some training courses, but we cannot cover all the team, all the health staff. It was covered by MSF at the beginning of, but later on, we don't have the time to cover all of those medical health. So a lot of them, they got an infection. And we lost a lot of our friends, but not in our projects, them outside around. In our projects, there was just only about 3 to 4 doctors and nurses who got infection. I was one of them. Actually, it was very, very difficult. Then after I recovered, I insist to come back to work because I know now what's the patients suffering from it. So, thanks God, and I hope all the rest patients in the ICU to be recovered as soon as possible.
Yeah, and Diana, how was it for you to manage that whole situation?
So to complete a little bit what Dr. Nisar was saying, I think in Yemen, as in everywhere in the world, there's a high peak of mortality at the very beginning, and then it starts going down. Even if we still have a lot of patients, the teams learn we learn from the other countries. So mortality has been decreasing, and also we're having a little bit more of access of about certain materials or medicines, and even more staff that can come back to work with us. So it hasn't been easy to see such high mortality rates. It's the first time that I have so many deaths in a project, and it's hard to have to deal with the logistics of dead bodies and huge amounts of oxygen and huge amounts of waste, and it's a whole different way of working that we have never seen before, and that we're learning day by day. So it's been challenging, but it's been very motivating. And the team that we have is extremely motivated. It's very open to all of the trainings. Once again, we don't know everything because we're also just learning from what's happening. But we are lucky that we can get that motivation like put in a good way of working.
Yeah, it's what you're describing is the emotional and psychological toll that certainly doctors in other parts of the world where they were really facing full hospitals and that high mortality rate, the difficulty that they have to overcome it. But then it's also people who were caring for those who have COVID-19 at home and the fear of all of that. We have a number of questions coming in from people who are watching us on Zoom and on YouTube and on Twitch and all of the rest. This is from Frederica. Does COVID-19 also have an impact on cholera in the country? Maybe Deanna, you could take this one.
So cholera has been around in the country for a long time already. Dr. Nisar, he also knows because we actually in Al Kuwait, we used to do already interventions for cholera. So it's something that comes back every now and then. We're crossing our fingers so it doesn't come back very soon, because really it's not a good moment to have it. With the rains that are happening, we will see how it evolves.
A related question in terms of the specific vulnerability of Yemen is also the food insecurity. Hassan, this is something that we've been watching for many years. What kind of concerns do you have about how the food insecurity is affecting our ability to deal with the pandemic?
The food insecurity and malnutrition has been present in Yemen since many years. The effect of the war on it is that more people couldn't have enough purchasing power to be able to have enough resources. We see it in another way. We see it, for example, the effect on children who are malnourished even before they are 6 months old, which is very strange. Usually malnourished children are over 6 months, and we see it because the mother is obliged to go to work and she cannot give her baby a formula milk. So it has very strange impact. It's not just a shortage of food, but it's how the people can access this food, and what do they prioritize. For the moment, people are still prioritizing buying food for their family. However, they are taking from their economies. They are selling land. They are so it's a very difficult situation if it continues like that. It's not something that the people can resist more, be more resilient. That's the word I'm searching for.
A related question from Kathy, who asks it via Zoom. Are there COVID cases being identified among children in Yemen, as we see in the United States, for example? Deanna, are you seeing children?
We are lucky that we are not seeing many children, and we're really lucky that it's not the case. We've had a couple of them, not more than 10, I would say. But it's not easy to manage them. So we really hope that we don't get more.
Yeah, it's difficult though, as you described earlier, with the lack of testing capacity around the country. And if the people are not so sick as to come to the hospital, their chances of getting tested seem quite limited. Just a follow-up to that topic from Jake, who's asking, is there access to diagnostic testing in Yemen? So we covered this a little bit earlier, but maybe Nizar, you could speak to this. What is available to somebody who thinks they have it?
As we said, we have a shortage. There was a global shortage regarding the tests, especially for the PCR for the COVID-19. But day by days, we are depending more on simple facilities that we have. Even we don't have a CT scan inside our hospital. We depend on the simple chest X-ray and the skills of our doctors in the triage and the AR and the IPD in the ICU for the symptoms and the signs, which day by day is improved. And still we are depending on it, except some people who came from outside, from another private hospital. They came by confirmed cases by the CT scan results. We depend on it too much, and that's it.
Yeah. We have a question here for you, Nizar, from Shruti Sharma. What is the general mood of the people in Yemen in relation to the overall situation in the country? I mean, we had talked about the cascading problems of the war and malnutrition and cholera, and it just seemed one thing after another, and now this. So how are people doing?
Yes, a lot of crises they are facing in our society in Yemen. But as I told you, the people, they still denied, and they said we don't have COVID-19 in Yemen till today. Most of them, they say we don't have a COVID. So that's it. And a lot of suffering also from people regarding this. That's it.
We have a question here from Anushka. Are there violent threats, for example, bombings or attacks, affecting MSF hospitals and operations in Yemen? Hassan, what do you know about the security environment as it affects our work?
Well, it depends where we are. We had 5 of our health centers and hospitals have been bombarded during this war. We had even a death in our teams and in our patients during those bombardments, aerial bombardments. This is especially in the north of the country, in areas where there is a lot of airstrikes and still ongoing until today. It's still a very dangerous area to work in. In the south of the country, navigating through different fighting due to war, but also due to fights in families and in neighborhoods is a different type of threat environment to work on and to navigate in. So it's today Yemen is one of the biggest operations for MSF due to all the medical needs, but it's also one of the dangerous that we are working in.
A question here from Borchue Wu on Zoom. Are you seeing different outcomes in Aden or in Sana'a, or is MSF's operational response similar in both places? Hassan, what do you know of the difference that we're seeing in the both regions?
It's the same. It's the same that we saw. The same result, I would say, from in terms of mortality and in terms of what the patients are responding to. So in the 2 projects, we are minimizing the use of invasive intubation, and we are moving to use of non-invasive intubation, and we see an improvement in how the patients are responding to that. So mortality rates in our intensive care unit is improving. However, the only difference is that the curve in Aden was much shorter. It was much quicker, while in Sana'a it's staying. It's going down, but in a very, very slow tempo. And this curve is not the epidemic curve; it's the curve of the patients that we receive in our hospital. So this is how we are reading the epidemic for the moment.
Yeah, and I'm sure there will be lots to analyze. I mean, this has been a phenomenon with a novel virus like this, how much you learn about what are the techniques that work better. But with people having better survival rates in the hospitals, I have a question for you, Diana, from Catherine Brown. Are people afraid to go to hospitals or clinics because they think they might get sick inside the hospital and have worse outcomes for having gone? And if so, what are MSF teams, what is Doctors Without Borders doing to encourage people to come and reassure them that things will be handled in a safe way?
So we had sort of two phases of patients' arrivals. The first one was at the very beginning of the epidemic. People were really afraid to come to the hospital. There were a lot of rumors, a lot of misconception. So people didn't want to come in. They were arriving very at the very late stage. And now we're receiving a little bit more people that come maybe before. But then there's also some kind of denial. So it's just, they think it's just a regular respiratory infection. The caretakers, they want to come in, they want to visit their families because they say coronavirus is over. So it changes very fast. So we face those two ways, and now we're adapting to how to not make the caretakers and the other people that are coming for other diseases not to get infected, because then we don't want to give them nosocomial coronavirus.
Peter is asking, are people required to wear masks in Yemen? And if they are they wearing them? I guess not, if people don't really believe it's a real thing. Diana?
I think Dr. Nizar will be able to tell you about the outside world of the hospital. In the hospital is mandatory, and we wear it all. But in the streets, Dr. Nizar can tell us more.
Yes. You mean in the community, Avril?
Yes.
Yeah, they stop even the social distance and wearing the mask outside. You know, in our malls and markets, it was a mandatory in the previous month to wearing them. You couldn't go to inside the malls without a mask. Now it's free. All of them, they said we don't have more coronavirus, and we are okay.
You know, I was watching the footage from Beirut and their first responders dealing with, you know, trying to rescue people, to get them out of harm's way. And looking at the pictures, I was really struck by how many masks I was seeing in Beirut among those first responders. I mean, not everyone, some of them are wearing under the chin and others are not wearing. But it's clear that that when you have the compounding effect of a catastrophe, or in the case of Yemen, you know, the crisis of bombing, shelling, and all the violence that can go with being in a conflict zone, mixed with the pandemic, it's just unfathomable. Hassan, maybe you can just, since we started with you and talking a little bit about the work that you're also managing for Beirut and the emergency response there, how you see this mix exacerbating the problems that we're likely to see in Beirut, just as an example of something that's very much on our minds.
I think I was surprised. I'm Lebanese, so as well, but I was surprised to see since the beginning of this pandemic and the cases in Lebanon that the people started wearing masks. I was thinking they will not wear it. Everyone was wearing it because they knew that the health system in Lebanon is weak already, and in case the number of severe patients that need hospitalization go up very, very high, we will just collapse. So the people was wearing it out of fear of it. And now with this bomb that happened, I agree with you. I saw a lot of people still wearing them, not the majority, but today it's changing again, and the people are going back to taking care of that, because the people are afraid of this mix of so many factors, economy and the blast and the homelessness, the health system will not be able to cope.
Well, let's do a final round. We have many people asking, how can they help? it's sometimes so overwhelming what's going on all around the world. And when we really focus in on Beirut and on Yemen, it's sometimes also you just think, my goodness, what can I do? Hassan, what would be your message to those who would like to help?
I've been following Yemen since 2017. I've been there in 2017, and we see the number of donations going to not only to Médecins Sans Frontières, but to the UN, to the whole humanitarian community, is decreasing a lot, and this year has decreased a lot. And without this humanitarian aid, it would be very difficult for the population to keep going. Today, there's no work, there is no income, there's no trade. The country is closed up. So for us, for us in Médecins Sans Frontières, we are suffering with that. We're seeing other NGOs around us that we used to be working together, filling gaps here and there. It's still not covering the whole country. Now we see them decreasing their projects and their support one by one. And this year was really very like a big decrease, even with the COVID, and the people are decreasing, and we see less activities. We see health centers that used to have malnutrition children are not supported anymore. Usually people who are like given assistance is not receiving it anymore. So we need this. For us in Médecins Sans Frontières, we also are suffering from this crisis to be able to find all the drugs and the supplies to send, and to have enough people to send and help as well. We need for us, we need people, we need supplies to be able to continue working, because Yemen is, as I said, it's one of our biggest operations. It's very big, but there are other countries that are also starting to suffer from this pandemic. So we are increasing everywhere. And I think most importantly for me is not to forget that there is Yemen, and this is happening there, and there is an ongoing war since now 5 years, and it doesn't look like there's a near end.
Diana, what do you tell people who say, I'd like to help, what can I do?
I would say wash your hands, take care of yourself and others, wear a face mask when required, and fund us. We are really underfunded. I find myself comparing prices of antibiotics so that I give the cheapest one that is still good quality. And it's hard for me as a general physician to have to make these concessions and to have to think, I'm going to use this instead of that because this is way too expensive, and it's actually not that expensive.
And finally, Nizar, what can people do to help?
I advise everyone that we are still waiting for the second wave of COVID-19. We are not in safe side till now. So everybody, they should take care.
Okay, we will. And I really wish you lots of courage, and to the entire team working in Yemen, thank you so much for all the efforts under very difficult circumstances. And I really appreciate that all of you were able to take a bit of time off today to talk to us. It's been really a rich conversation, and I wish you all the courage in the world to keep going. My guests today have been Dr. Nizar Mohammed, MSF anesthesiologist and an ICU doctor in Yemen, Dr. Diana Galino Pineda, medical team leader for MSF in Yemen, and Hassan Abouchar, deputy emergency desk manager for us. Thank you all, and thanks to you if you were watching. Thanks for joining us. I really appreciate all these really good questions. Apologies if we didn't get to your question today. We'll be back with another of these Let's Talk COVID episodes in a few weeks. We're going to focus on disinformation next time. This whole question of the falsehoods and how it makes life so much more difficult for all the health workers who are doing their best to keep people safe and get us through the worst of this. So for more information on all of this, you can check out updates on our website about our work in Yemen, about our work in Beirut, about our work in all the crisis zones, emergency situations around the world where Doctors Without Borders has activities. In the US, our website is doctorswithoutborders.org. Internationally, it's msf.org. We have a number of Facebook sites. In English, it's msf.english. On Twitter, you can find us at @msf_USA. And on Instagram, we are also all over it. So for more specific questions that you might have, please don't hesitate to contact us. We would love to hear from you. We have an email address called event.rsvp@newyork.msf.org. I'm Avril Benoit signing off, and thanks again for tuning in. Bye for now.